The most common complication of shingles by far is postherpetic neuralgia, when there's significant pain lasting after the rash initially. Postherpetic neuralgia can be fairly serious depending on how long-lasting the symptoms are, and so it can wake people up from sleep, it can keep them from sleeping, it can make it harder to do day-to-day activities like, going to the gym, going to work, or like really living without pain. It can be really difficult. From people who have shingles, about 10% or so in the US will get postherpetic neuralgia. If you are unvaccinated, you're slightly more likely to develop postherpetic neuralgia, and people who are 40 or 50 years old start to become a little bit more at risk of developing shingles and therefore postherpetic neuralgia. Shingles can affect the eyes in several different ways. Most often when it does happen, it can affect the nerve that innervates the eye or allows the eye to see, move around. What can also happen is the retina can be affected as well. And so there are several different ways that can just lead to potential complications or even blindness if it does affect the eye. I've seen fewer cases of shingles affecting the eyes rather than it affecting other parts of the body, but it can happen 10 to 20% of the time. If you notice any rash that might be shingles and you're worried that it could be, it is important to reach out to your doctor early, as there are potential treatments that could prevent disease progression or severe disease moving in the future. If you have any symptoms around your eye that you're worried about being shingles, it is important to see your doctor because it may be important for you to see an ophthalmologist very quickly to make sure that you have no loss of vision.